Hi, I'm Scott Winkels, and I'm going to talk to you today about the League's mental health legislative priority. In 2015, the League prioritized mental health services out of a recognition that people who were suffering from these conditions were not getting the services they needed. We were seeing far too many negative police interactions. We were seeing people homeless on the streets who weren't in a condition to assist themselves, and we were seeing a system that was generally inhumane, and this was untenable to the city leaders across Oregon. In anticipation of a difficult budget year, the League's General Government Committee, its members through the balloting process, and its board of directors through a robust discussion again agreed that mental health services should be a priority for the League of Oregon Cities. The League will be asking the legislature to first preserve the instructor positions at the DPSST that were added in 2015, that's the police academy, to provide training to police officers to help them respond effectively and with compassion to persons suffering from a mental health crisis. We will also be asking to preserve, if not expand, grants provided to agencies for interdisciplinary teams that will proactively work with individuals in the field to keep them from going into a mental health crisis. We will seek to preserve mental health housing assistance to keep folks in a home. It's easier for us to deliver treatment to a person in a residence if they don't have that concern. And finally, we're going to seek to preserve, if not enhance, the number of mental health beds throughout the state of Oregon. In closing, what I will say is remarkable about the way this priority came about is that it was a priority across Oregon. There was no urban-rural divide. Cities in eastern and western Oregon agreed that this was priority. Highly urbanized cities and rural communities all recognize the problem, and we look forward to working with the legislature to bring about a more humane mental health system for this state.